Hello and welcome to EHI TV, your essential news on video. My name's Lyn Whitfield and I'm Managing Editor of EHealth Insider, and today we're going to be looking at the mobile health market. With me I've got Declan Grogan, who's the Managing Director of NDL up in Wetherby, and back in December they put out a report all about mobile and how it was about to take off in the health sector. Declan, just start by telling me a bit about NDL.
Okay, so NDL is a privately owned ISV. We're 30 years in April, which is a remarkable history in the UK. We service public sector. 95% of our business is public sector, although we do some of the larger FTSE sort of organisations. These days, we make tools in two areas. Integration, so the need to bring silos of information together, and then toolkits for people who want to mobilise those silos of information and get them into the field.
Okay, so tell me a bit more about this survey that you did back in December. Who did you survey, and then what did you find as a result of doing it?
From the local government work we've been doing, the mobile area became increasingly important, and as we entered the health sector, that emerged as well. So essentially we have a team internally, and we spoke to 200 senior figures inside public sector organisations, both local authority and health, and then drew out that. And really it's about helping us understand what's happening in the market space so that we can provide solutions and tools that are fit for purpose, and that we can intercept the markets at the right places with the right offerings. Yeah. So
as far as I remember, because we did write a short story about it at the time, what you found was that you were predicting a revolution. A lot of what you were talking about there was initially more business-focused apps, I think, than more clinical ones.
It's not necessarily the sexiest area. There's a lot of talk about telehealth.
Important,
absolutely, fantastic solutions in that area. But if we look at the drivers we have, we've got the demographic time bomb. We've got this huge demand on savings and efficiency. We've had Connecting for Health, which has been very focused on the spine and the centre and acute. And yet, kind of the mundane is where the savings are going to be made. There are, 37,500 midwives out there, day in, day out, going into domestic settings. There are, 80,000 community nurses. In our experience, a lot of those organisations are still using techniques and business practices that, and it is a business practice, I make no apology for that, which you wouldn't find in the commercial sector.
No, log sheets and going back to the office and
signing up. Let's examine the day of a community worker who goes across town into the office at their time and their expense, at the worst possible time of the day. They're collecting information on paper, which I would argue is not as secure as it could be. They're going out, they're making notes, handwritten notes often, yes, updating a patient-held record, coming back to the office, re-entering that information. And I was with some clinicians the other week who are saying, they can't get in the car park, let alone on a machine. And yet we've had solutions in field where, for repairing taps, where, you need a Corgi registered engineer and they get it on their device and they go and they do the job and they've got the schedule rate.
You sign for it electronically and off you go.
When was the last time you signed on a piece of paper for a parcel?
No, years ago. No.
And I kind of believe that these clinicians, their time is so precious, so valuable, we have such a demand, surely we can put some simple tools, not great huge projects, not great panaceas, there are a few simple things we can do which will let them do the job they're really trained to do and care about, and do a lot more visits a day. And we are seeing now, on some of the follow-up work we've been doing, where we're seeing clinicians doing 2 or 3 extra visits a day, saving an hour. Now you multiply that, an hour per clinician per day. That's an awful lot.
And so just very briefly, over the next year or so, where do you really see the big hits coming in? What are you expecting to see the health sector picking up on?
I really do believe, it's about the community workers. Everything is saying, if we can care for people in their homes, we can save an absolute, fortune and meet the growing demand out there. If we can save admissions, if we can, we save on premises, all that sort of stuff. And people have a better experience. So it's all about the community. We have lots of the mergers and changes going on, but mental health, midwifery, community nurses, district nurses, allied health professionals, those guys out there, we can really give them the support. And we are talking there about tens, if not hundreds of thousands of people and saving them hours in all their days. And that, I think, is massive.
Okay, lovely. Thank you very much indeed for that, Declan. It's really interesting to be talking about this today because we've actually got the health bill back in the Lords, but Stephen Dorrell on the Health Committee has put out a very important report on social care, talking for much more integration and some addressing of it.
Yeah.
So, yeah, it's good to see that people are thinking about the computing and the mobile needs of those people. Thank you very much indeed for watching, and we'll see you again next time we have an interview for EHI TV.